1. Which of the following best describes the purpose of USP 797 guidelines in sterile compounding? A. To regulate labeling standards for oral medications. B. To establish requirements for non-sterile compounding practices. C. To ensure sterility and prevent contamination of compounded sterile preparations. D. To standardize pharmaceutical pricing and distribution. 2. What is the primary function of a laminar airflow workbench, LAFW, in sterile compounding? A. To sterilize syringes and needles. B. To provide a continuous flow of HEPA-filtered air to maintain sterility. C. To measure volumes accurately for admixture. D. To store hazardous drugs safely. 3. Which of the following is considered a critical site in sterile compounding? A. The barrel of a syringe. B. The plunger shaft of a syringe. C. The needle hub and tip. D. The protective cap of a vial. 4. A technician preparing chemotherapy admixtures must work in which type of hood? A. Horizontal laminar airflow workbench. B. Biological safety cabinet, Class 2. C. Standard chemical fume hood. D. Refrigerated compounding enclosure. 5. What is the minimum frequency for cleaning and disinfecting ISO Class 5 primary engineering controls PECs? A. Once daily. B. At the beginning of each shift, before each batch, and after spills. C. Weekly. D. Only when contamination is suspected. 6. Which of the following statements is true about beyond use dating? It is determined only by the manufacturer's expiration date. B. It is assigned by the compounding technician based on labeling preference. C. It is based on USP guidelines and stability data for compounded preparations. D. It is not required for sterile preparations. 7. When reconstituting a powdered medication in a vial, what should be injected first? A. The diluent slowly into the vial. B. The air equal to the volume of diluent into the vial. C. The drug powder into the diluent container. D. The needle into the vial stopper without injecting anything. 8. In sterile compounding, which PPE item must be donned first during garbing? A. Sterile gloves. B. Gown. C. Shoe covers. D. Hair cover. 9. What is the purpose of the media fill test? A. To verify drug potency. B. To assess aseptic technique competency of personnel. C. To test sterility of raw ingredients. D. To ensure correct storage temperature of products. 10. Which of the following is classified as a low-risk CSP according to USP 797? A. TPN preparation with more than 3 additives. B. Mixing 2 sterile ingredients in an ISO Class 5 environment. C. Preparing chemotherapy requiring hazardous drug handling. D. Compounding using non-sterile bulk powders. 11. Which type of filter is most commonly used in sterile compounding environments? A. Carbon filter. B. HEPA filter. C. Ceramic filter. D. Nylon mesh filter. 12. What is the correct order of donning garb for sterile compounding? A. Shoe covers, gown, mask, gloves. B. Hair cover, mask, shoe covers, gown, gloves. C. Gloves, mask, gown, hair cover. E. Mask, gloves, gown, shoe covers. 13. What is the ISO class requirement for an anti-room supporting high-risk compounding? A. ISO Class 7. B. ISO Class 8. C. ISO Class 9. D. ISO Class 5. 14. Which of the following statements about hazardous drug compounding is correct? It can be performed in a horizontal LAFW. B. It requires a negative pressure biological safety cabinet. C. It is exempt from USP 800 requirements. D. It only requires standard surgical masks. 15. When should sterile gloves be disinfected with sterile 70% isopropyl alcohol during compounding? A. Only at the beginning of the shift. B. Whenever the technician leaves the clean room. C. Before and after contact with critical sites and surfaces. D. Only when gloves appear visibly soiled. 16. What is the appropriate action if a sterile vial is found with a cracked stopper? A. Use the vial if the contents appear intact. E. Discard the vial and report the issue. C. Reseal the vial with a new stopper. D. Wipe with alcohol and proceed with compounding. 17. Which component of the syringe must never be touched to avoid contamination? A. The plunger tick. E. The syringe barrel. C. The outer portion of the plunger shaft. D. The graduation marks. 18. What is the minimum recommended time for hand washing prior to sterile compounding? A. 15 seconds. B. 30 seconds. C. 60 seconds. D. 90 seconds. 19. In sterile compounding, the first air refers to A. The initial air that flows from the ceiling into the clean room. B. The HEPA-filtered air that directly contacts critical sites. C. The air immediately surrounding the technician. The first airflow cycle of the HVAC system each day. 20. What is the proper technique for breaking an ampule? A. Break it away from the HEPA filter. B. Break it toward the HEPA filter to keep it sterile. C. Break it under running water. D. Break it with the protective sheath still attached. 21. Which of the following describes a medium-risk CSP? A. Mixing multiple sterile products for a single patient in ISO Class 5. B. Preparing emergency doses without garbing. C. Performing hazardous drug compounding. D. Compounding non-sterile to sterile preparations. 22. Which disinfectant is recommended for routine cleaning of compounding areas? A. 10% bleach solution only. B. Sterile 70% isopropyl alcohol. C. Soap and water exclusively. D. Hydrogen peroxide wipes. 23. A compounded sterile preparation prepared in a segregated compounding area, SCA, has a maximum BUD of A. 6 hours. B. 12 hours. C. 24 hours. D. 48 hours. 24. What is the purpose of a closed system drug transfer device, CSTD? A. To reduce the risk of hazardous drug exposure. B. To sterilize non-sterile powders. C. To provide filtration for air entering the vial. D. To extend the beyond use date of preparations. 25. Which of the following conditions would automatically disqualify a technician from performing sterile compounding? A. Wearing contact lenses. B. Having open skin lesions on hands. C. Having seasonal allergies. D. Wearing prescription eyeglasses. 26. When compounding hazardous drugs, what type of pressure should the buffer room maintain? A. Positive pressure relative to adjacent areas. B. Negative pressure relative to adjacent areas. C. Equal pressure to adjacent areas. D. No pressure differential is required. 27. Which needle gauge is the largest in diameter? A. 18 gauge. B. 20 gauge. C. 22 gauge. D. 25 gauge. 28. How often should HEPA filters in a clean room be certified? A. Every month. B. Every 3 months. C. Every 6 months. D. Every 2 years. 29. Which term refers to the area within the LAFW where sterile compounding should occur? A. Critical site. B. Direct compounding area. C. Secondary engineering control. D. Anteroom. 30. What is the primary risk associated with touching critical sites during sterile compounding? A. Dose inaccuracy. B. Cross-contamination of other medications. C. Introduction of microorganisms leading to patient harm. D. Reduced potency of the drug. 31. Which of the following CSPs requires the shortest beyond use dating if prepared in a low-risk environment? A. Room temperature preparation. B. Refrigerated preparation. C. Frozen preparation. D. Emergency use CSPs. 32. Which compounding record must be documented for each preparation? A. Compounding log, including ingredients, lot numbers, and technician initials. B. Only the drug name and expiration date. C. Patient's billing information. D. Pharmacy inventory sheet. 33. Which of the following is not considered appropriate PPE for hazardous drug compounding? A. Double chemotherapy gloves. B. Disposable gown with closed front. C. Open-toed shoes with shoe covers. D. N95 respirator or equivalent.